Hey everyone, it's Sarah with registerednursern.com, and in this video, I'm going to be going over the adolescent's growth and development. And as always, whenever you get done watching this YouTube video, you can access the free quiz that will test you on this content. So let's get started. The adolescent, also called the teenager, falls within the age range of 13 to 18 or 19 years of age. Now before this, the adolescent was considered a school-age child. And in the previous reviews, we talked in depth about the infant, the toddler, the preschooler, and the school-age child. So if you need to watch those videos on growth and development, you can access those right up there. Now during adolescence, there's a lot of changes that are occurring. This child is changing physically, emotionally, and cognitively. And if you look at a 13-year-old and then compare them to an 18 or 19-year-old, you're going to see there is a difference in how they look. They should look more adult-like. Also, they should be more mature in their thinking abilities and their skills. So adolescence is a very challenging time for a child because they are dealing with all of those changes physically that our younger age groups really didn't have to deal with. Plus, they're trying to find their identity, dealing with their body image, and trying to maintain relationships because peers are really important to them. So to help us remember all those important concepts about the adolescent, we're going to remember the word teen. So T is for the big changes, and one huge change we're dealing with during this age range is puberty. And puberty, what it is where the reproductive organs are becoming active. Hence, that person's going to become sexually mature and they can make offspring. So they're going from child to adult. And what becomes active for the girls are the ovaries and boys the testes. Now let's look at some quick facts about puberty. So girls tend to start puberty about 2 years earlier than boys. And puberty lasts about 5 years. So all these changes that person is undergoing doesn't happen over a month or two. It happens in stages over this time period. Therefore, you can look at the changes that are occurring in a girl or a boy and determine how far along they are in puberty. So you can use what's called Tanner stages, and this is a 1 to 5 point scale, with 5 being the most mature. So for girls, it looks at the breast development and the growth of pubic hair, and in boys, it looks at the genital area, the enlargement of the penis and the scrotum and the pubic hair. So first, let's go over the changes of puberty for a girl. Now, girls tend to start puberty anywhere between 8 to 13 years of age. And the first sign that a girl is starting puberty is that there will be breast changes, so the development of breasts. Other changes that will happen to that girl throughout puberty is that there will be an increase of hair growth, which will be under the armpits and in the pubic region. And there will also be the increase of weight. So fat is now going to start to be stored on the abdomen, the butt, and the thighs. Also, the hips are going to widen over time as well. So the average weight for a girl in the US that's 18 years old is about 125 pounds. And then there's the increase in height. So for both girls and boys, this is a time of major growth. So depending on the female's genetics and other factors, she could potentially grow up to 8 inches during this time period. So the average height for a female in the US that's 18 is about 64 inches, so 5'4". Now the thing with girls is that they tend to stop growing 2 years after menstruation. So once they get their period, 2 years after that, they will typically quit increasing in their height. And menstruation tends to occur about 2 to 3 years after puberty starts. Now, other changes that occur, not only do we have our reproductive organs like our ovaries being active, but other things start to become active, like glands. And we're talking about the sebaceous and the apocrine glands. So sebaceous glands secrete oil, so there's going to be an increased risk of acne developing, zits, pimples, and the apocrine glands, which are sweat glands. And this can increase the amount of sweat that the person puts out, plus it can lead to body odor. And finally, there are emotional changes during this time as well, because we have hormones involved, especially with the ovaries, things being released like estrogen. So we can have emotional outbursts, mood swings, irritability, and some depression. Now let's look at puberty changes for boys. So boys can enter puberty anywhere between 9 to 14 years of age. And what happens is that the penis and the testes will start to increase in size. Also, there will be an increase of hair growth. So you'll start to see an increase of hair growth under under the armpits and the pubic area, on the chest, the legs, the arms, and even the face. There will also be voice changes. So at first it may sound like that boy's voice is just squeaky and starting to crack, but as time goes on, it will start to become deepened. And you can actually see these changes because the larynx on the throat will start to increase in size, and we refer to this as the Adam's apple. So you can start to see that. Now the larynx does increase in size on girls, but it's not as prominent as it is in boys, and that's just telling us that we have voice box changes. There will also be the increase in weight, and this is due to the increase of muscle mass this boy is putting on. The average weight for a boy in the US that's 18 is about 147.5 pounds. There will also be the increase in height. So during this time, the boy can increase by a foot in their height, with the average 18-year-old boy here in the US with a height of 69.3 inches, and boys tend to keep growing until they're about 20 years of age. Other changes that occur are similar to the girls. With their skin, those glands become active, so they get those problems. And they will have emotional challenges as well because reproductive organs are becoming active, so we have testosterone on board along with other things, which can lead to moodiness and agitation. Now, some other changes that the adolescent will be going through will be some teeth changes. So before, with our younger age groups, we were cutting teeth, we were losing teeth, but now we're starting to wrap up that process where we're going to fine tune and have all of our nice 32 permanent teeth. So by the age of 13, they should cut their second molars, and then by the age of 17 to 21, those last set of molars, the wisdom teeth, will come in. So during this time, some adolescents have braces to correct any crowding or other orthodontic issues. So it's important you stress that they go to the dentist regularly, at least twice a year, every 6 months, and the importance of continuing to brush their teeth twice a day and to floss daily. Plus, the adolescent is changing socially. So before, during the school age time, friends were important. They were starting to love to hang out with their friends. But now, peer influence is a major part of the teen's life. They will dress how their friends dress, consume the foods that their friends consumed, and do the same activities as them. And there's a lot of peer pressure during this time period. So what teens like to do for fun is that they like to keep into contact with their friends. So this will include text messaging, using social apps, talking on the phone, surfing the internet. They may also be working at jobs. They like to go to the movies, and they just like to hang out with their best friend groups and have a close relationship with them. And then they may even play competitive sports. Now, during this time, the relationship between the child and the parent is also changing because they are starting to separate from their parents and challenge their authority. This is all very normal. So they are yearning for independence, and they don't want to be restricted by rules, especially the older they get. So the child and the parent relationship can become strained, but once the child becomes an adult and they mature, the relationship can actually become really close. But during this time, they need to branch out and find their identity. So with all these changes that are occurring to the teen during this time period, it can lead some teens to feel not too sure about these changes. And then plus, when you throw on peer influence, it could possibly lead to a negative body image. So let's talk about body image for a second. So body image is how you view your body. And if you don't have a positive body image about yourself, it can really affect how you view yourself, like self-esteem, your self-concept, which in the end can lead to depression and eating disorders. And this isn't a thing that just affects girls. It also affects boys as well. Now, during the time that we live, this generation faces more challenges because we have the internet, which bombards us with media and social media, and it's constantly showing us what's pretty versus not what's pretty, what's the ideal body and what isn't the ideal body. So with this, teens, they like to use social apps, and one thing they like to do is they like to post pictures and post videos, and they get feedback on those. And if they're not getting the feedback that they want, it could lead to a negative body image. Or they're looking at other people, their friends or celebrities, and they see these pictures. And these pictures sometimes aren't what really is reality. It may be filtered, it may be manipulated, but to them, that's what it really is. So it can lead to problems. And one thing, an interesting article by the Mayo Clinic was talking about how teenagers are really affected by social media. And this is one thing it said in the article, and I quote, "A 2015 study found that social comparison and feedback seeking by teens using social media and cell phones was linked to depressive symptoms." So this is something that we really need to help the teen understand and help them not have a negative body image. So what are some things that we can do? Well, we want to be real with that teen. So one thing is to be a role model for that teen. So as a parent or whoever is with that teen a lot, you want to make sure that you yourself have a positive body image and that you put an importance on being healthy rather than looking a certain way or having a certain weight. And if you struggled with this as well, share that with the teen to let them know that this is something that people struggle with. E is for eating disorder signs. So you want to be looking for signs and symptoms that your teen may have an eating disorder. One eating disorder is anorexia. This will present with where the teen won't eat, they'll restrict food, they will be obsessive about losing weight, exercising, they'll be negative about themselves. Or there's also an eating disorder called bulimia, and this is where the teen may consume lots of food and then they will just run to the bathroom and throw up afterwards. They'll do this a lot, or they will use laxatives. Next is to avoid the media trap, and I touched on this just moments ago, but you want to make sure that there's understood rules for how the teen should use social media, and talk to the teen about how not everything you see on TV or in a magazine is necessarily how a person looks or how their life is. And then lastly, love the teen. So let that teen know that you love them and that you care for them, and don't concentrate on how they look or on other people's looks, but qualities, and praise them and build them up and help them to feel confident. The next part of our mnemonic is E for education. So these are the educational points you want to go over with the teen to help promote their safety, because this is actually a dangerous time for the teen due to accidents that could lead to death. So we have the teenager, their body has changed physically, they're adult-like, they have amazing strength and endurance. So they have maturity in some things, but in some things not so much. And some teens just really don't have a great ability to really see the consequences that are going to happen. Like, yeah, they know it could happen, but they think, that's not going to happen to me. That happens to everyone else. I'm mortal. So they engage in like risky activities. One thing that is big during this age time is driving. Around 16, that is when most teenagers start to drive. So that leads to a lot of dangers. And unfortunately, according to the CDC.gov, motor vehicle fatality is the leading cause of accident death among teenagers, representing over 1/3 of all deaths to teenagers. So as you can see, driving safety is really important for the teenager. So some things you want to include in education would be taking a driving course, which is usually offered by most high schools. The importance of always wearing a seatbelt, whether you're driving the car or if you're a passenger in a car. Rules on driving, so who you can ride with, who you can't ride with, not text messaging while you're driving or using your cell phone, and not driving under the influence of any substance. And some other safety concerns would be self-harm, like suicide. And unfortunately, a recent article by UCLA Health said that suicide is the second leading cause of death in people ages 15 to 24 in the US. So as a nurse, you want to make sure you're assessing for those risks of suicide, which could include the following: leaving messages on social media or hints telling you that they want to die, telling people goodbye, they quit socializing all of a sudden, they have outbursts of anger or depression, giving away things they own, express being a letdown to others and saying life would be better without them, having a plan that they have written or shared with you, or they've experienced a recent traumatic event like a death of someone, they're being bullied, or a rejection. And if the adolescent is displaying any of these signs, you want to get them help immediately via a mental health facility. So in addition to the safety concerns with self-harm, there's concerns about substance abuse, because teens can be around other teens or other people who are using substances. They may feel pressured to use those because they want to fit in with the peer group, or they're rebelling against their parents. So you want to make sure you discuss with the teen substances that they may come into contact with and how to handle those situations. And also discuss swimming dangers, sports, make sure they're wearing that protective gear to protect their head and other organs, dangers with gangs and firearms. Next is health education, and there's several categories you want to discuss with them about this. One is sleep. So make sure the teen understands that they need at least 8 to 10 hours of sleep per night. It's going to help them feel better throughout the day, help them with their mood. It decreases the risk of obesity. And believe it or not, you do a lot of your growing at night as a teenager because that's when your growth hormone is secreted. So some things that can affect sleep is that staying up too late, so you don't go to bed until 11 or 12, and then you have to get up really early for school. You're not getting in that time. So you want to set a schedule and say, hey, I'm going to sleep at this time every night so I can get that period of time of sleep. Also, the teens like to use devices, they're on their cell phone a lot or computer or any device that puts out that blue light. That blue light can affect your ability to sleep throughout the night. It messes with your sleep cycle. So you want to make sure that you're limiting your device usage before bedtime. Also, they need to know that they need to exercise at least 1 hour every day, moderate to vigorous exercise to help just promote health and decrease obesity. And they need sex education along with nutritional education. So during this time, they are growing. And as you've seen, they can grow a lot of inches throughout this time, and their body is just changing with hair growth, the increase in muscle mass, etc. So we need to make sure that they are consuming enough minerals and vitamins to facilitate that growth. So they want to make sure they consume good calcium, iron, protein, folic acid, zinc, and vitamin D. Now, the teenager, again, they have a lot of social influence. They are busy with school and other activities, so they may not consume what they need. Now, why would they not consume? What are some reasons why teenagers have poor nutrition? Well, one thing obviously is that their life becomes very busy with activities, friends, and other commitments, and it's just easier to eat foods that are high in calories and really don't have nutrition. Plus, parents' influence on food choices is limited. They are eating and drinking what their peers drink, and that includes usually a lot of soft drinks, energy drinks, or coffee type products where there's going to be less milk and water intake, and they may have a negative body image. So they may start skipping meals thinking that will help with weight loss, or they may overeat to cope with stress, which could lead to obesity. So as a nurse, you're going to be measuring their height and measuring their weight, and you want to see what their BMI is. So here's the following BMI chart for the teen. They are considered underweight if their BMI is less than 5th percentile for the age, height, and gender. Normal if the BMI is 5th percentile or greater, but not higher than 85th percentile. Overweight if BMI is 85th percentile or greater, but less than 95th percentile. And obese if BMI is 95th percentile or greater. Next, we have our other E for Erickson's, Piaget, and Kohlberg's theories. So for exams, you definitely want to be familiar with these theories for the adolescent. First, I want to talk about Erickson's psychosocial development theories. So the stage that the adolescent is in that you need to remember is identity versus role confusion. So the teen is independent. They're allowed to get out, experience the world, of course, with their parents' somewhat supervision. And this really helps them form their identity because they're going to be in different social relationships and other experiences, which is going to help them grow and explore and figure out who they are and what they want to do. So this is going to drive them in their future relationships, their careers, and goals. So the goal of this stage before we can get to the next is for this person to get fidelity. And this is where they have a commitment or faithfulness to obligations. So if we can get them to form an identity, they will become a stable, productive person who is faithful to their obligations in life or duties. Now, they can enter in with role confusion where they get confused about who am I? What am I supposed to do? So what can happen is they become unsure of themselves and they sort of just drift around in their educational, career, and relationship pursuits and really can't settle on anything because they really don't have an identity. Then next, we have Piaget's theory on cognitive development. So you want to remember that the adolescent is in the formal operational stage, and this is ages 12 years to adulthood. So our adolescent is really mature in their thinking. They went from being concrete thinkers, like how our school-age children were, to more abstract thinkers. They can plan for their future, especially later on through this age range. They're starting to understand cause and effect, and they can hypothesize. They can manipulate ideas or situations in their mind without actually seeing it, and they can solve problems in their mind without actually having to figure it out on paper, actually see it. So they're really advancing in their thinking abilities. And then next is Kohlberg's moral development theory. And the adolescent is in the social contract orientation period. So we know that the teen knows that others have different ideas on what is right or wrong. Hence, everyone has their own moral values. So the teen, yes, understands that we have laws and rules that majority of people agree on, although some groups of people will disagree on them. But everyone will try to work together, hence reciprocate, or have like a social contract to follow these rules and laws so society can exist and function. However, the teenager is starting to understand that people have rights and basic human freedoms and moral personal values they follow. And if laws and rules hinder or go against these, there's an exception for the rules or the laws. So they're starting to understand that people may not follow the rules or the laws if it goes against their personal values. And then the last part of our mnemonic is N for nurse's role with the hospitalized team. So whenever the teen is hospitalized, there's some things you want to be aware of, especially their fears. So some fears that the teen will have will be separation from their peers. Before, with our younger children, it was separation from their parents. And in the school-age child, yeah, there was separation from peers. They didn't want to be forgotten about. But this is a little bit deeper for the adolescent. It's fear of being rejected, that they're no longer going to be part of the group because they're not there. Another thing is loss of control. And again, this is different. We're in there, we're interrupting their way that they live, we're invading their privacy, which is another thing that they fear, and they're not being able to be independent and do what they normally do throughout the day with school and friends. So they've lost control, and the teenager will act out. They may get really angry, they may refuse to do something, and that when they do that, that gives them a sense of control. I already touched on privacy invaded, so with that, make sure you are taking that into account and letting them have their time in their room, and that if you have to do anything that shows private parts, that you take care to cover them up as much as possible. And then they have a fear of death and becoming deformed, because remember, body image is a huge thing for teenagers because they're changing. They have peer influence. So you want to take all that into account. Therefore, there are some interventions we need to remember as the nurse to help the teen with dealing with these fears. One thing we can do is be completely open and honest with the teenager about procedures, about things that are coming up, because teenagers are really good at knowing if you're being for real or not. And they may hide their feelings, so not really communicate if they're scared or anxious, or ask you certain questions. They won't. They'll avoid doing that. So as the nurse, you want to anticipate questions that they're going to have about certain things and answer them without them having to actually ask the question. You also want to give them as much control as possible in decisions and activities. So if possible, let them eat food that they want to eat. Have their parents or someone bring them food. Let them wear their pajamas instead of that not so nice looking gown in the hospital, and let them have their own routines if possible. Also encourage social activities. If there's a recreation room on your unit, incorporate the teen as much as possible and get other teens involved so they can socialize. And maintain privacy, and whenever you have to teach them with creative ways, such as with videos that are age appropriate, diagrams, photos, and again, encourage questions and anticipate those questions. Okay, so that wraps up this review on the adolescent's growth and development. If you would like to watch other videos in this series, you can access the link in the YouTube description below.